Good morning. Thank you for joining us today as we talk Right Care First Time, how PMI mental health care is evolving. So mental health remains one of the most complex and in-demand areas of private health insurance, and in recent years we've seen shifting consumer expectations as well as rising demand for mental health services alongside product evolution. And I'm really pleased to be joined by two expert speakers today as we delve into this topic. Please do share your questions as well. We will be doing a live Q&A at the end. We have Emma Taylor, UK Clinical Lead at Wysa, and a qualified mental health nurse who specialises in children's and young adults' mental health, and also an expert in digital innovation and AI. Emma, great to have you with us today.
Nice to be here.
And we have Simon Miller, Director of Everyday Care at Vitality Health. And Simon, you're a real kind of expert in those partnerships and developing everyday kind of care solutions as well as digital innovation. So again, thanks so much for joining us today, Simon. So let's just kick things off. And Emma, perhaps just if I can turn to you to begin with, just to give us a picture of the kind of the mental health landscape out there. There's obviously, it's quite challenging. We know we just had Mental Health Awareness Week. And yeah, can you just give us a bit of a sense of what it's like out there?
I think we're at the position now where mental health services are at complete overcapacity because demand is higher than it has ever been. And that is for so many different reasons. You've got over 2 million adults in the UK now seeking support for mental health. You've got considerably more children looking for support with mental health than we've had previously, but the demand in services isn't there. So what we're seeing is significant increases in people becoming more unwell whilst waiting for care kicking in later, but we've also seen a real backslide of people's opinions towards mental health. So we, for a while, had a really good upwards turn of people thinking proactively about mental health. And what we're seeing now is slipping back into some of those negative stereotypes that we've seen in the past.
And Simon, Vitality's recently done some polling that's kind of delved a bit deeper into, people's challenges around health, mental health, and their expectations as well around sort of mental health care. Perhaps you can just give us some of the kind of headline findings from those.
Yeah, thanks, Rob. I mean, really interesting. I mean, we've clearly made great progress around increasing awareness around mental health and to an extent reducing some of the stigma. There's still significant challenges, particularly in the workplace. And perhaps some of that has been brought on around the return to work and some of the working pressures and the pace we're moving at with AI developments, for example, and some of those demands. And as Emma alludes to, there's a real risk here of taking a step backwards in some of that great work that we've done. So we've seen, for example, from our polling data, that 61% of people still feel that mental health is affecting their productivity at work. So we've got challenges still around productivity, absenteeism, stigma in the workplace. More broadly, we're seeing a shift in the sort of nature of demand for resources as well. And therefore, we've got to have better tools to guide people along that journey, but also be able to help navigate with confidence. And I think we're looking at feedback from employers that they want that as well, not just a menu of options, but help me navigate my employees with confidence into safe, trusted tools. And on that last point, this is really coming out in our polling as well, particularly with Gen Z and particularly with parents with children. Access to safe, trusted tools, particularly in an AI world, is absolutely paramount. The younger generations are more mental health aware and they are looking for support, but they're not necessarily engaging with resources that might be available to them in terms of professional support. They're going to open AI tools, general purpose tools, for example, which can in some cases be better than nothing and can be reassuring, but doesn't necessarily have the regulation, the hand-holding, the safeguarding that you as a parent would certainly want your child to be experiencing. So we're looking at tools, and we'll come on to speak a little bit more about that later, I'm sure, to help meet some of those needs amidst some of those emerging trends for open access to everyday support.
Yeah, and Emma, let's pick up on that point Simon mentioned there around children's and young adults' mental health, which we know is a bit of a kind of growing challenge. What's been your experience of kind of, on the front line? What are you seeing out there in terms of that sort of children and young adults?
I mean, we're now at the point that many people on the front line consider the epidemic of children's mental health to be more dangerous to this generation than COVID was, because we're at the point that over 500,000 children in this country are waiting for mental health support. So that's not even the people receiving it. That's just the people that asked for help and were told, hang on a second, we've got a 6-month to 4-year waiting list, depending on where you live in the country and what type of specialist support you're looking for. And that's why we're seeing more and more parents kind of saying, actually, we can't, this is not sustainable. That's having a massive impact on workplaces, because you've got parents that are having to take days off work to look after children that don't feel able to attend school because of anxiety or stress. You know, you've got, I think it's 1 in 4 children that have had a day off school because of stress in a year. That's a huge number.
Gosh, yeah.
And then that's a day that a parent's not at work. Or you've got, you know, higher than ever numbers of children who don't attend school on a permanent basis for stress and anxiety. They're often schooled at home, which means a parent is working from home, which means they're present at work, but how engaged are they in their work? And that has massive economic impact, which then has an onward impact on what services can afford to provide.
Yeah, so that point around getting the right care sort of first time, I guess, is really crucial, Emma, in terms of, you know, from your experience, that sort of prevention, early interventions, sort of getting the right help. I mean, how important is that? How?
Ultimately, it will make or break your therapy. If you imagine, I don't know, you were queuing up in a line and it was one of those magic shows and you've got a ball under a cup, and that ball is the right outcome for you. It's the thing that's going to help you. And the person in front of you juggles all the balls up and says, right, pick a cup and see if the ball's under it. That is essentially what happens if you don't have guided support into early intervention. And if you open the cup and there's no ball there, back to the back of the line and you can come and have another go when you get to the front. That kind of process of not knowing what you don't know. You don't know if you need talking therapy, MDMR, do you need some resilience support? You don't know what you don't know because you're not meant to be an expert in mental health. That's the whole point. So having a guided support system that can say, you know what, these are kind of some of the common situational difficulties that are happening. Do we need to go left? Do we need to go right? And getting you to that right place means you're far more likely to engage in the end outcome. It also means, rather than just going, right, everybody off to therapy, because ultimately in this country, you will never have enough therapists. If everybody who ever had a bad day said they needed a therapist, we would never have enough people. We don't have enough people as it is. So having people being able to be empowered to go and find support in other means and methods, that might be talking to an AI chatbot, that might be having online virtual therapy sessions, it might be your young person joining a live streamed gaming session where the gamers are talking about mental health, which is through the sandbox. All of those things have their right place, and putting those in place helps people go from this feeling that anxiety and stress is an awful thing and we must never experience it, because ultimately anxiety is your body's way of protecting you from something that's dangerous. It's just that in today's modern world, we have confused the saber-toothed tiger hunting us with going to work and doing our daily activities. So we're not trying to eliminate all stress and anxiety. We're just trying to empower people to be able to manage that feeling in a way that feels healthy for them. And that will look different for every person.
I think the other thing to add to that as well is it's important to recognise these tools aren't mutually exclusive. You know, the role that a digital tool might play alongside therapy to increase adherence and keep me on track in between my sessions as well, that might be dealing with the deep trauma, but the tools might be dealing with my everyday highs and lows as well. And that could be anything from sleep challenges to conversations, preparing me for talking at work with my therapist, dealing with challenges within the family as well. I think the other thing as well is those digital tools, we're not saying that, okay, it's a digital tool and that's your lot. The digital tool might be a first step of opening up, talking about feelings and emotions, practicing some basic CBT type techniques that then, if and when it does come to maybe stepping up into therapy, can make it much more effective. I'm on a journey. So I think it's really important. It's guided care, not gated, and it's also not exclusive as well.
Yeah, it's an interesting point that I guess, Simon, is this an area where maybe we're seeing health insurance sort of differ to what you might access out there in the public, in that it's more of a kind of integrated pathway?
Yeah, I mean, I think we have the luxury to an extent of a couple of things within the private space. One, there is that access and the timeliness of that access, and that's hugely important, right? We're getting people seen within days, not weeks, not months, which tragically is the case around the country for some. So one, it's around that access. Two, as you're alluding to, Rob, it's around guiding. It's not a you can only see this option. It's a recommendation. And then 3, I think it's around that hand-holding and curation of those journeys, where as much as we can, we integrate that so that we're not duplicating assessment questions and you're feeling like you're telling somebody the same thing again, which again is that friction, that dropout, and just a poor customer experience, right? So if we can increase the access, we can improve the experience, and we can provide the right solution first time, then you inevitably see better outcomes. And I'm really pleased with some of the scores that we see from patients reporting their outcomes, that we are, for example, able to help over 80% of our members reduce their severity of their outcomes after having the sessions with us. And for the other 19%, a large proportion of them are no longer declining. And that's hugely important. It may not be the be-all and end-all to their treatment pathway. They may need other support, but we've arrested some of that decline.
Yeah, and I'm right in saying, aren't I, Simon, that we've seen, as I mentioned earlier, we've seen demand go up, but actually through those pathways, by getting in earlier, we're actually bringing down those sort of more, extensive claims that may otherwise arise by getting in earlier and supporting.
Yes, both mentally health and physically health related as well. So a reduction in inpatient psychiatric claims, for example, we can correlate that and see the causal effect of talking therapies, but also for physical health claims and comorbidities. We all know mental health and physical health go together, but that will, if you're struggling with depression, anxiety, that will impact your prehab, your rehab as well, and your return to work as well from those physical health conditions.
Yeah, and an area that Simon's sort of spoken about a moment ago around the use of kind of digital tools and stuff is obviously something that I think you're an expert in and have some experience of, Emma. So perhaps something we can talk about is there's obviously, we hear a lot now around AI, and AI is being used by people in their everyday lives now in a way that wasn't the case even a few months ago. What sort of digital innovation are we seeing in mental health care, specifically around AI, and what are some of the kind of risks, challenges, but also benefits to that?
It's a really interesting one, because I think as a society we often go, AI, this is a really scary thing. This should not be interacting with us when we're at our most vulnerable. But as we have just spoken about, sometimes it's AI or nothing. And if have you got no one to talk to and nowhere to go, sometimes being able to digitalise that support is effective. And kind of, I remember when I first started looking at kind of digital intervention in mental health, and it was because we used to give out like worksheets. I've lost count of the amount of times I used to photocopy like worksheets and stuff to give to people, and the amount of bus companies that used to phone us and say, oh, we found your worksheet on the bus. So you clearly weren't going to do your home practice if the worksheet is still on the bus. Digital tools tap into the digital nature of our lives. Lots of us do online banking, we do online shopping, we know how to interact with our phones, and you can be sent reminders, it can help with adherence, and that's excellent, and we've seen really good results with that, and AI is almost a little bit of a step onwards from that. Some of the major benefits of AI is that we know, particularly with younger generations, that there is a real fear about talking to an adult. So young adults and kind of sort of 40 and under, we know that statistically they're more likely to talk to an AI than the older generations, but they're also the generation that tend to be struggling the most at the moment. So having an AI where they can reach out and they can start having that early, this is a question, is it something I should be worried about? Is it something that's normal? Being able to ask those questions. I interview a lot of young people for work, and a young person told me recently, it's impossible to ask an AI a stupid question. There's no one there to judge you, and that's a really important thing. So I think that's where AI holds a lot of benefit. It gives people places to explore questions they're not yet ready to speak about with a person. But that is also why there has to be a lot of clinical safeguarding in place. Yeah. Your generic AIs are not designed to have complex mental health questions asked to them. They're not designed to be able to have that two-way conversation. And there are clinical AIs out there that are designed to support mental health. They are also not designed to replace therapists. If somebody has got a chronic and enduring mental health condition, they need to be spoken to by a therapist. They need that support. But those AIs, when they're clinically trained and they've got clinical input into them and they've got guardrails that can pick up suicidal ideation or self-harm intent and signpost you to a person, always making sure that we're moving people that are high risk into in-person conversations, they can provide a space to explore for people that are very early in their kind of experience of mental health, or that are just asking curious questions, or asking curious questions about their children or their friends or their colleagues, without it being a space that feels judgmental or stigmatizing.
Yeah, and when we talk about AI in this context, we're not talking, in the context of it being, harnessed through a private health insurance plan. We're not talking about sort of AI chatbots that people are using in their everyday. There's clinical guardrails in place and trained and a kind of.
And they're medical device licenses, and they are regulated, and they have to go through rigorous checks, and you have to do clinical safety cases to say that actually this AI is not perfect, and it's not gonna, it's not gonna save the world's mental health crisis, but it is going to provide quality early intervention support and advice, and help signpost people into the right places at the right time, so that preventative agenda can escalate and can move at speed in a way that we as a population need.
Yeah, and in the kind of what we've been deploying through Vitality's proposition is using some of this tech, isn't it? But it's been designed and it's kind of got that clinical oversight.
Yeah, I mean, it's purpose-built AI, to use the cliches, but they're important ones. It's purpose-built, human in the loop, it's regulated, safeguarded. I mean, these tools have gone through significant research, significant scrutiny, and that's just so important for us to be able to then say, okay, to a parent, for example, here is a safe tool for you to be able to provide. And that's not to say that they can't be abused. That's not to say that there will still not be high-risk cases within those that need to be caught and flagged out. And God forbid, there may be one or two that also get missed. But those are missed in the real world today as well. And they will be missed even more so if no resources or support are given to the general population. So, it is a careful walk that we're going on. We need to be careful as a society, as an industry, that we don't race into this blindly. But also we've got to meet people where they're at. As Emma said, for younger children, they want anonymous conversations. They want to be able to reach out on their terms. They don't want to be judged. And that, use of general AI can mean, as a result, a lot of affirming conversations, which aren't always helpful and positive. So there's an education piece that we've got to do here as well, not just provide access to the tools, but educate.
Yeah, and Emma, none of this replaces actual, therapists. When somebody needs to speak to a person, there's still a place for speaking to a professional.
Absolutely. There's, at the moment, if we look back 5 years ago, before AI was so prevalent, there was kind of one funnel. Everybody had to go to the same place. Everyone had to go to in-person therapy, and everyone was going in the same door, and it just meant nobody could fit through. What AI does is it gives you more entry points, more exit points. It means that people that really need that in-person help, they need it quickly and it's urgent, can get there faster, because people that have got questions about how do I have a conversation with my child about starting counselling aren't standing in the same line. And it means that support can also be available at times that it maybe isn't traditionally. So we know from Wysa's data that young people under the age of 18 are most likely to talk to the AI chatbot between the hours of 8 p.m. and 10 p.m, which is when traditional therapy talking services aren't open.
I guess, Simon, a question though that advisors watching today may have is, when we're talking, are we talking about kind of all mental health needs being covered by private health insurance? What are some of the kind of...
Yeah, I think that's a really good question to ask, because I think we need to be aware of the limitations, what private medical insurance is for, and what private healthcare can and can't do around mental health, whether you're insured or self-pay. So, the first thing to recognise is, there are still, as Emma's pointed out, only so many therapists in the country. And particularly as you start to then get down to children's cover, into regional areas, there may be some limitations in availability and accessibility. So we do our best as a private health insurer to meet that demand and provide that accessibility, and particularly through remote resources if it's not in-person resources. But there may be in some instances where that's not available in that region, and the best place for that person to be is seeking through NHS care, for example. So it's just worth noting that in terms of that limitation across the country. I think the other bit is to recognise that private medical insurance is still around providing support for acute conditions, not for chronic long-term illnesses, and also to note that private medical insurance and talking therapies in particular is not appropriate for all conditions. If somebody has suicidal ideation, if somebody's facing domestic abuse, if somebody's facing self-harm, emergency services, crisis support needs, reaching out to their GP, for example, if there's medication implications, these are much more appropriate places. So having this clinical assessment up front will help guide people to the right care and handhold them where appropriate. So there is recognition here of some of the limitations. The other bit is, obviously, there's lots of emerging technologies, lots of emerging therapies. We always want to make sure that these tools, whether digital, in person, whether it's medication, are always evidence-based, NICE recognised, for example, in terms of medications, and present good value for members as well. So we need to be mindful there of premiums and inflation as well in some of these new areas. Psychedelics, for example, fascinating field, but monitoring the evidence, monitoring the demand, monitoring the cost, and the effectiveness relative to other pathways is something we'll always be keeping a close eye on. The other area I think it's worth noting as well is around behavioural development needs. And we've seen a significant increase in society as a whole for demand for neurodiversity assessment, diagnosis and support. And there are some limitations with PMI depending on the product options that have been chosen as to the cover for that, for diagnosis and for treatment pathways, for example. But nonetheless, within our general talking therapies, we can still support people with their associated symptoms. So we might not be supporting with a diagnosis or a treatment, but we can support you with the stress, with the anxiety, with the other symptoms that may be related to that condition. And that's particularly prevalent within children as well. So for example, through the Sandbox from Minder, we see 35% of the children presenting either have a neurodiversity diagnosis already or might be appropriate for that. But nonetheless, we're supporting them with better outcomes with everything relating to that. And I think, Emma, you see that in your services as well. And maybe have a comment or two on the nature of some of that demand. Where is this demand coming from?
Yeah, I think the whole neurodevelopmental debate is very interesting because it is the largest wait list for NHS services is for assessment for autism or ADHD. But one of the reasons for that is because private assessments are still fairly unregulated. It's a little bit of a Wild West out there at the moment. You're meant to have a whole MDT behind some of these assessments, and some private assessors is kind of a one-person band. And actually the regulation of medications, if you receive an ADHD diagnosis and you want medication, that then has to continue privately. That's got onward costs for parents and for families because it can't always be transferred back to the GP through shared care. So there's quite a lot of complexities around it. And I think one of the reasons we see more driving demand is because there is more awareness. But there's also, the number one reason parents always come to me and say, I need an assessment or a diagnosis is normally because of challenges at school. And they're looking to put an EHCP in place. And parents are often incorrectly told that an EHCP cannot be put in place without a diagnosis, when in fact an EHCP assessment can be done before a diagnosis. A lot of what the difficulties around is back to there being a lack of qualified staff, a lack of educational psychologists to do that. And getting a diagnosis doesn't necessarily move you higher up the list. But what you can do is, rather than looking at the label to change the outcome, because the label doesn't change the outcome, is what are the things that need to change for an adult or for a child experiencing these difficulties, and frame it in the idea of those life difficulties. Is it social anxiety? Is it difficulty with routines? Is it difficulty with transitions? Because all of those things we can support whether you put a label on it or not. And we see that through the support options that are available in Mindler for younger people. We see that through some of the talking therapy options for adults. And that means that you can make real quantifiable changes for a person who is perhaps waiting for a diagnosis through the NHS, or perhaps is suitable for a diagnosis, but ultimately the label doesn't result in a change, the lifestyle results in the change.
And Simon, so somebody then who's waiting for a diagnosis though for say neurodiversity elsewhere, there's still support though available to them through some of the stuff we've been talking about.
Yeah, absolutely. So, whether that might be appropriate for talking therapies to be used in the meantime to support with associated anxiety, for example, that emotional regulation around the condition and the symptoms that I might be dealing with. So certainly there's a role for talking therapies. But remember, when you go through our services as well, you're having a clinical assessment up front. and you're being monitored by a therapist throughout. And if that therapy isn't appropriate, then they will be making recommendations and referral on to appropriate services, whether that's covered by the insurance or not. And that in itself is hugely valuable to know, actually, yes, I may need a diagnosis, or I may need to see a psychologist, whatever that happens to be, as an appropriate next step. So very important to recognise that we can help people still who might be on a waiting list, who may be diagnosed already, may be wondering whether diagnosis is appropriate for me. We can still support them as a whole.
Yeah, really interesting. Well, look, I think just to kind of wrap up this section before we jump into a live Q&A with my two guests here, Simon, where, if we think about some of the developments we've seen in the private healthcare space and indeed healthcare more broadly, kind of what's next? What do you sort of see coming when it comes to mental health and sort of what we're discussing here?
Yeah, I mean, look, I think the developments will follow the demand, and the demand, I see, is becoming more nuanced. A demand for more personalised solutions, down to matching me with specific therapies. To now it's largely been CBT, but our providers are able to do much more than that. And taking through a good clinical assessment, we can not just get you with the right therapist, but the right program, the right modality, the right duration. So I think that demand and expectation is evolving, and having the right tools as a provider there to meet that demand is absolutely essential. I think the shift towards proactive versus reactive continues, and that needs to come from employers, that needs to come from us as providers, but also that education and awareness to our clients, to our members, particularly with children right now, is, if your children aren't having those conversations with you, they're having conversations with someone else or something else. And that may not always be the right thing. So even if you believe they're in good health right now, introducing them to proactive tools to maintain that good health and get on top on those dips potentially before those become, chronic illnesses. So I think providing those proactive tools, getting them into the right hands, but also the positioning of those. This isn't just for mental illness, this is for mental wellness, maintaining it, even if your children or you are thriving today. How do we keep on top of that? Little things like the breathing exercises and sleep. I mean, absolutely, sleep is so significant. We've done our own research on that, vitality, the 7-1-1, getting at least 7 hours, getting that within an hour of that same window each week, and just making sure that consistency is there is hugely important. And through some of these mental wellness tools, such as Wysa, for example, we see people present with anxiety, we see people present with stress, but the number one tool packs they end up gravitating through, sleep, always the time. So these daily behavioural change, lifestyle changes and habits that we can build are just so important. So getting on top of those before you see yourself as mentally unwell or mentally struggling and needing to seek clinical support. Yeah.
They say that the sleep paper you referenced there is a fascinating bit of research. We'll share that in the chat so you can have a look at it. But we'll look, a fascinating discussion. I think some really interesting insights there for advisors who are perhaps having these conversations with clients, sort of wanting to understand how private health insurance works when it comes to mental health. So we'll now jump into a live Q&A with my guest speakers. So please do share your questions, and we'll see you on that in just a second. Thank you. Great morning, everybody. Well, thank you very much for joining us. So we'll now jump into a live Q&A. As I say, do share any questions that you have in the chat. Unfortunately, Emma couldn't join us for this section. She's had a family emergency she's had to attend to, but I'm really pleased that we've got Davey joining us, who is Head of Partnerships at Wysa and is himself a qualified CBT therapist. So thank you very much for stepping in at short notice here. And Simon, great to have you joining us as well on this really important topic and a very live topic at the moment. I think the BBC just came out of a story the other day that children's mental health referrals are kind of hitting record highs for anxiety and things. And obviously we know that mental health as a general amongst the whole population is a real challenge. So obviously a very live and very relevant topic. Perhaps if we just jump into some questions. So we've had a few come in already, and I think a really important one that I just want to throw out to both of you, if I may, is someone's asked what kind of provision is in place if during that triage process, or indeed during the interaction with an AI tool or anything else, there's red flags discovered that require more specialist support or intervention, such as suicide risk. What kind of interventions and things are there to kind of step in at that point? Perhaps, Simon, if I come to you first, and then Davey.
Yeah, absolutely. So really pertinent question, and absolutely at the heart of our thinking when we're designing these pathways and these tools. So we take the opportunity within our journeys at several stages to both educate about what these services are for and what they're not, and then also to provide captures to be able to then signpost off to appropriate services. So, that might be a combination of stating clearly what those services are and not when people enter into our care hub, our member zone, and interact with these. When they come through the triage tool with Wysa, clinical questions there that will appropriately ask if somebody is at self-harm or has had suicidal thoughts. And then equally, when handed off to our partners for talking therapies, that will obviously form part of a clinical assessment as well. And if there is a positive answer in that, if somebody's in a digital-only journey, then it's about us having those right tools. And it's not just based on questions, but also building in, using AI, for example, red flag alerts around the nature of the usage. We can then pick up on that and signpost off and say, look, this service is possibly not right for you based on what you've presented. You think you should seek help. That could be via A&E, that could be via NHS, it could be signposting off to, for sort of maybe not quite such crisis cases, immediately off to other services, could be even into Samaritan support or shout service lines. But if you're with our therapists as well, when you're engaging with a human there, that human playing a role in hand-holding as well. And that can even involve our therapists, for example, calling out emergency services, making sure that they've arrived and somebody's in safe care, and taking it upon themselves to update the individual's own GP practice as well. So, yeah, those are the kind of steps we build in. Maybe David might want to talk a little bit more to some of the digital elements of that within Wysa's red flag alerts.
Yeah, no problem at all, Simon. Those were already really comprehensive and cover already some of the things that we do within both the triage tool and obviously the Wysa app. I think on top of that, and just to add, because Simon is absolutely right, both the app and the triage tool check things, check for specific words, check for specific scores on particular questionnaires, so that we can see where someone is at. If it's the case that they're showing some form of risk, then yes, there are specific escalation pathways, and that is a kind of a good amount of choice between the ones that Simon already mentioned. But if someone falls in between kind of that, where they don't necessarily already maybe need that urgent response or anything like that, and they feel maybe not ready yet to reach out for more professional support, the Wysa also has things built in, like creating a safety plan together with them. It means that they then get access to really specific tools and coping strategies, as well as dedicated members of their family and friends that they can kind of set to reach out to be able to kind of handle that. So for every part of that layer, you kind of have answers, and all are very kind of clinically validated, obviously. So
yeah. It's a robust the process. I think another question here that someone's asked, I'm going to ask you as well, if I may, David, which I think is really important and really relevant, and we touched on it in the discussion earlier on, and this is around kind of the workplace. We know that mental health is one of the leading causes of sickness, long-term sickness absence in the UK, and a real challenge at the moment that employers are grappling with it, and obviously employees themselves are struggling with at times. And somebody's asked, kind of beyond employee assistance programs and wellbeing initiatives and those sorts of things, what organizational changes can employers make that can reduce the risk of stress and poor mental health in the workplace? I think just, drawing on your kind of experiences and your kind of clinical expertise, what kind of things can employers do if they're wanting to sort of address these challenges?
Yeah, no problem at all. I think it's all about creating kind of a safe kind of culture in the workspace. if someone already feels like they aren't able to reach out or make use of all the things that maybe employers put in place, kind of have those open door policies where people can ask the questions or be referred for support. When that isn't created, then it's really hard to kind of for a person to reach out and say, I am struggling and I need some extra support to be able to make this work. We've seen whenever we kind of did that in services, that having kind of regular check-ins, not kind of just those standard, it's Mental Health Awareness Month, we're going to do a webinar in that month or anything like that. Having that kind of really standard approach to every few weeks, there's opportunities where people can just come together and able to kind of address those things and talk openly with peers about things. It's really helpful in that way. And then obviously those being able to reach out and use some of the digital tools that are out there to really practice those psychological skills that you can learn that people might not know how to kind of use. So, yes.
Yeah. And I guess, Simon, a kind of, Davey's touched on that, like a one size fits all approach to this isn't the answer. It's about having a sort of a suite of solutions. So when we are talking about workplace health and well-being benefits, whether it's health insurance or employee assistance programs, some of the things I guess that Vitality's put in place is a range of different tools depending on an employee's different needs and what an organisation may be looking for.
Yeah, but I think in the workplace bit, I think what David picks up on is hugely important there about culture. It's not just about tools and solutions, the sticky plaster to the wound, right? What's the root cause of this stress? And we know a huge amount of mental health issues outside of work relate to work. People are taking that home. We know from our recent research that we had, I think it was 50% of people citing that they have considered taking time off work in the last year due to stress, burnout, anxiety. Yet only 5% would actually consider talking to their line manager about that. And that gap there in terms of psychological safety in the workplace. And particularly now, if people feel vulnerable about their jobs, their security, AI threats, redundancies, even more so. So how do you create that safe culture? How do you improve line manager training, mental health first aid training? So those types of initiatives that Vitality provide through our coaching, education and awareness and training, as much as just the solutions when somebody is confident in putting their hand up and seeking support.
Yeah, and somebody's asked another question, someone I might just put to you if I may, because someone's asked, I think, a really relevant question, given this challenge around children's mental health and well-being at the moment, is around ADHD, kind of neurodiversity, those sorts of things. And we touched upon it again in the earlier discussion. Someone's asked, will there ever be is that something that private health insurance will cover? And I guess, we touched on it a little bit earlier on, Simon, perhaps you can just kind of reflect on that and offer your sort of view on.
Yeah, I think things have definitely changed and are continuing to change around this in terms of how private medical insurance looks at these long-term behavioural, lifetime conditions potentially. And we do provide options for our corporates, for example, to be able to buy up and provide access to those assessments and initiate treatment plans within their organisations for their employees. But it does come at a significant cost. And I think there's a challenge here of meeting some of that demand. And as Emma alluded to, some of that demand may not always be driven by the right, the right drivers in terms of that. And if you're then funding it as an employer, that's a huge exposure. But to the other point, as Emma alluded to, also just making sure that there's one thing funding the assessments, but what does that then lead to? If you can't then support that individual or their family with the right care in the community, or the shared care agreements back with NHS GPs and ongoing medication, then it's a bit of a sort of false door. You're just shifting really the bottleneck within that pathway. So I think there's a more systemic issue really around how neurodiversity is supported throughout the health system. And then us to be able to look at we can really add value and not just sort of push the problem a little bit further downstream. But I also think it's not just about, as Emma alluded to, about access to assessments. It's access to support, education, content, tools, help me manage traits. Not everybody wants to be diagnosed, and particularly we hear a lot of parents with younger children saying, give me the tools as a parent to help support and manage my child. I don't want this to define them, but I do want to be able to support them. And I think that's where some of the tools that we've now got available through the Sandbox and Mindler can help the parents, not just the child as well. And we can also help with the associated conditions. So the Sandbox and Mindler, we've had live for over a year now. There was some really interesting data. 35% of children coming through those talking therapies are presenting either with a neurodiversity diagnosis or might be appropriate for one. But yet we're still able to help with the associated anxiety, with the associated stress, and other symptoms through talking therapies as well. So we can still support, even if the assessment may not at this point be covered on all plans for all members.
Yeah, which I think is just one of the things you mentioned earlier on around that kind of actually can help at that stage. So look, I think another really relevant question. I mean, someone's asked here around the role of AI in mental health, which I think we've touched upon in the discussion, but I really like the first part of their question around how we reliably measure outcomes. So Davey, from your perspective at Wysa, I mean, how are you measuring the kind of success of these services and these tools in terms of health outcomes?
Yeah, no problem at all. We do that in various ways, as you can imagine. The questionnaires that obviously are asked both in the app or before someone accesses a service really can help in seeing where someone starts their journey, how they kind of improve whilst they're using a digital tool. We've seen even that if we kind of look at people doing those type of assessments before they actually hit the talking therapies treatment, that if they engage quite in a good way with the app, that their scores actually go down before they even hit treatment. Some people even recover before they even hit treatment. So being able to help, like both Simon and Emma have alluded to in the interview, in making sure that people don't get worse whilst they're on a waiting list, and in the best case even improve, is something that can really help, both from a reach perspective and an effective kind of perspective. So yes, we track that in many ways.
Yeah, and I think I can add to
Simon,
that.
perhaps.
Yeah, sorry, Rob. I think I can add to that as well. I mean, there's the clinical outcomes that are incredibly important, right? And as Davey alludes to, there's different scales that we can look at that and capture those patient-reported outcomes. So that might be about, have you reduced the severity of your anxiety or depression, but also what impact has it had on you, using scales like there's a tool called the Wysa tool, for example, that will look at things like, has this enabled you to return to activities of daily living or feel confident returning to work, for example. So those are the kind of tools that we work with our partners to look at clinical outcomes. But there's also looking at claims outcomes as well. So we look at have people returned to therapy successively? Has it had an impact on inpatient claims as well? And we can see a really strong correlation there, a 21% reduction in severe inpatient mental health claims when people are getting good access to talking therapies up front. And then the third area, so clinical claims, and the third area is experience. What's the satisfaction? Did I feel listened to? Do I feel better as a result? Did I get prompt access? Am I engaging? Am I utilizing the services? So we kind of combine all of those factors together to monitor overall performance of our sort of therapy delivery partners.
Brilliant. Thank you, Simon. Yeah, well, look, we're running out of time, and I think there's a lot we could discuss on this topic. So I would definitely encourage anybody, if we've not had a chance to get to your question, we'll send out a recording and some various resources afterwards. So do feel free to respond to that with any additional questions and things you may have. But I think maybe just to wrap up, any kind of final reflections from you both in terms of where we're headed and the sorts of tools that are out there, and maybe Simon, from your perspective, where's kind of PMI heading, and perhaps I'll come to you, David, just for any kind of final reflections as well. So Simon, if I can just go for you.
Yeah, where are things headed? I mean, it's a really exciting time, both in advances in medication on the medical side, better markers for diagnosis of bipolar and other mental health conditions, for example. So I think that's really exciting in terms of AI, but not just for thinking about bots, right? Thinking about the back office experience. Well, how do we help our clinicians have better conversations with their therapists as well. And then for us, as more of these tools and solutions come out there, how can we better guide people into that? So a great step here with the Wysa triage model, but expect more to come in that space.
Yeah, and Dave, I guess technology is going to continue to play a role in all of this.
Yes, definitely. And I think the thing that I'm most excited about, both as a CBT therapist and a digital lead, is that regardless of the move to digital, it is always considered that digital exclusion is a huge thing, and we're getting better and better at making sure that that doesn't happen. We are reaching the rural areas, we are reaching the older populations, sometimes more than we do the young people even. So it's really interesting to see how all of that keeps evolving.
Yeah, brilliant. Well, look, thank you so much, both, for joining us today and taking those questions. Thank you to everybody who's tuned in. I hope you found it interesting. I hope it's kind of been thought-provoking, maybe giving you some things to think about for the conversations you're having with your clients. Like I said earlier on, it's obviously a really live, really kind of relevant topic at the moment for us to be discussing. So I just really appreciate everybody tuning in and listening today. And once again, Simon and Davey for joining us for this Q&A. We will send out a full recording to everybody who's attended today, along with CPD certificates and stuff afterwards. You're obviously welcome to share that recording with colleagues, pass it around. I hope that's obviously a very relevant topic. We'll send some resources as well. I will just quickly throw up on screen. You may be interested in having a look at Vitality's approach to mental health and some of the resources and things that we offer. And also, given that kind of relevant topic around children's mental health, you may be interested in having a look at an article that Vitality's Deputy CEO, Dr. Katie Tryon, recently wrote around how PMI is evolving for children's mental health support. So I've just thrown those links up on screen for everybody to have a look at now. Please do respond to the survey, share your feedback, really, really valuable to us in helping us to improve these sessions and cover topics and themes that are relevant and interesting to you. So I'll wrap it up there. Thank you very much again to Simon and Davey, and thank you very much to all of you for broadcasting, for joining us today for this broadcast. I hope you all have a very nice day. Thank you. Cheerio.
Thank you.
Thanks.